Welcome back, Halftime Howie, for the broadcast on the beach with Halftime Howie with Andy Malakoff, Executive Director and CEO of the North Shore Child and Family Guidance Center. Um, Now it's time to talk about the drug crisis in our society, and I want to ask a few questions. Been doing some research, and let's start with this one. How do drugs affect our society?
Well, I think they affect it in multiple ways. It has certainly an impact on families. It can destroy families. It has an impact on the economy, on people's ability to work productively, to show up to work. It has an effect on safety, the crime that's involved in terms of dealing drugs and procuring drugs. It has an effect on the soul of the community. If we live in a world in which something which is really a disease of isolation is making a statement about how unattached people feel, and that for them to get connected, they need to ingest or inject a substance, it says that we're really lost. And so it's a really devastating impact on all of us, Howie.
Absolutely. Next question I want to ask is why drug abuse is a social problem?
Well, it's a social problem because it doesn't only affect the individual, it affects the whole family, and it affects the network of people that are associated with a person who's using drugs. It's a family disease. The family members suffer along with the addict. The difference with the person who is addicted is that they are sedated most of the time. They're numbed by the chemical that they're using. The other family members are not. And so it has a devastating impact on families that deal with addiction. There's tremendous unpredictability, inconsistency. People in the family have to guess at what normal is. There is sort of an unspoken mandate: don't trust, don't talk, don't feel. And so the people who are associated, and again, particularly in the family, need to get support and to get the help that they need at the same time that they're trying their best to cope with the person who is using and who is addicted to drugs or alcohol. I want to make sure that when we're talking about drugs, that people understand it's alcohol and other drugs. Alcoholism is a huge problem, while the opioid crisis is one that we are all too well aware of right now, the epidemic. But alcoholism, binge drinking, blackouts, all of the things that young people who become overly involved with alcohol experience, it's critical. Driving while intoxicated, Mothers Against Drunk Driving is something that didn't get created in a vacuum, Howie.
Absolutely. Another question I want to have you touch on is what is the use of illegal drugs?
The use of illegal drugs. I'm not sure. Can you clarify that?
Drugs that heroin, cocaine. Let's talk about those things and how taking those type of devastating drugs is having the impact on our society.
Okay, well, I have to say, I don't really think that aside from the criminal element in terms of how they're procured, legal or illegal, addiction to chemicals is addiction to chemicals. And so I don't really see the difference. The difference, however, if you want to compare, for example, alcohol and alcoholism to the use of opiates, addiction is a progressive disease. So with alcoholism, it can take a very long time to reach what's referred to in the addiction field as your bottom, reaching the bottom, the point of no return. However, with a drug like heroin or fentanyl, which is a synthetic opiate, prescription painkillers, another form of opiates, this is a much more rapid progression, which the bottom, sadly, is often death in a very short period of time. And so while they're all addictions, legal or illegal, things you can get over the counter, things that you have to get on a street corner, things that you have to steal for, things that you can get out of your medicine cabinet or liquor cabinet, they're equally as devastating. There's really no difference in terms of the ultimate impact, maybe the pace, but no difference in terms of the ultimate impact on the individual and the devastating impact on the family.
Andy, one of the reasons I decided to do this show is I feel we need to help educate the society about this crisis. And one thing I think that is critical to talk about is the disease concept. Talk about how a lot of people don't understand that people addicted to drugs is a disease and not something that someone just decides to do just to get a high. Talk about the disease concept, because I think that's so important.
Yeah, that is very important, Howie. It gets back to something that I've talked about in earlier shows, just to put it within a frame, is that we have to start treating diseases or illnesses above the neck the same as diseases or illnesses below the neck. Addiction, as is mental illness, it's a brain disease. Why don't people see it as a disease? They see it as a defect of character, or as a lack of will, or as poor parenting. So there's something that's evolved in our culture over decades and many, many, many years that for some reason leads many people to believe that there is something that you can do about these diseases if only you were a better person, or if only the people around you were more vigilant, or provided better discipline or monitoring. But it is a disease. Addiction is a disease of the brain. It is progressive. It goes through, as I said, with alcoholism, a much longer period of time than heroin, as an example. But with many of the drugs that people are addicted to, the worst effects don't really come to visit until after a period of time in which multiple losses are experienced, whether it's loss of relationships, loss of jobs, loss of income, loss of family, loss of freedom, and then loss of life. And that's what progresses in this disease. Now, for a very long period of time, there was a division between the field of mental health and the field of addictions. And in the field of mental health, there were many who felt that addiction was a symptom of a mental health problem. And consequently, two fields developed. The recovery field in addiction is one that evolved as a consequence of feeling that the mental health field was not doing an adequate job in addressing the disease of alcoholism. And out of that recovery field came the 12-step movement, the recovery movement, and people are familiar with Alcoholics Anonymous, Narcotics Anonymous, Al-Anon, to help family members of alcoholism, Nar-Anon, family members of who are addicts of other drugs, heroin, cocaine, and so forth. And for a very long period of time, the primary focus in addressing this disease was abstinence and then sobriety. Abstinence meaning not using at all, and sobriety, living a sober life. The recovery program included the steps, the 12 steps, in which people had an opportunity to sort of turn over their sense of powerlessness to a higher power, to take a fearless moral inventory, to apologize to people who you've done wrong, to turn around and then do good for other people and to help other people. And that was a sort of a primary focus of the recovery and treatment. More recently, there is a movement towards medical-assisted treatment of addiction, which includes a combination of behavioral or talk therapy and also the use of medications such as methadone or Suboxone, which help to block the cravings for the use of heroin, as an example. And there's a form of treatment, a field of treatment referred to as harm reduction, where abstinence is not necessarily the final goal. There's an understanding that that may be too high a pinnacle to reach, and that people need help controlling their use through the use of medical intervention, as I said, such as methadone or Suboxone as an example. So the field has really changed dramatically in addressing what is a disease, not a moral failing.